My sister took a class in audiology and told me that she thought I would love it, and I took it and I did. I absolutely loved every part of it because it brought together the science aspect as well as working with patients and also being able to work to help them to fix as much of the problem as we could to help them live a better life. They're typically coming in with difficulty hearing, difficulty understanding. Sometimes they'll come in and comment about ringing in their ears. Occasionally it'll be dizziness. There's a variety of things that can bring them in. And we usually take a history to find out what problems they're noticing, how long they've been noticing them for, what types of things are going on in their life. Have they had any recent illnesses, changed medications, things like that that may have triggered it. For some people, they've had the hearing loss for a long time and they're finally deciding to do something about it. For kids, either it's a failed hearing screening that's brought them in or they're getting it prior to speech language evaluations, things like that. So we'll do the case history to find out what's going on, and then we do the testing to see what their ears look like, find out if there's fluid behind their eardrums, if that's playing a part, and then we do the testing to check their hearing loss and see where that is and what we can recommend from there. Probably the most rewarding part is when patients come in and tell me they didn't realize they were missing so much and what a difference it has made in their lives. Because you lose your hearing a little bit at a time, and so I always tell patients, because you lose it a little bit at a time, you learn different accommodations. So you might turn the TV up a little bit, or you ask someone to repeat themselves, or you don't realize that you're missing the conversation 3 people down because you heard the one right next to you. And you do that a little bit at a time, not realizing that it's because of the hearing loss that you're missing these things. And then when they get to a point where suddenly life is a whole lot harder because their hearing loss is much worse, when they do something about it, they often will come back in and say, I can't believe I waited so long and I can't believe I was missing out on so much prior to doing these.